I just told Konstantin that I had several cases. They were not operated by you, but somebody else. In one case, I found those threads inside zygomaticus major muscle inside. Surgeon is known and with practice of 20 years. And once I was taking off those threads and I could not elevate them because there was some obstacles, and later on I had movement problems because probably it was too deep. Yeah. So of course the threads I am talking about non-resorbable threads. Of course, many of followers do not probably follow all the instructions you give, and sometimes it is not really predictable what you will see. So thank you.
Thank you very much. Yes, of course, we always say that all threads should be placed in subcutaneous tissues, not deeper, because it's a safety layer. Nowadays, I think 90% of all threads that are used in the world are absorbable one. Non-absorbable are not the history, but very small part of thread lifting. And of course, training of the doctors is number one before any procedure of thread lifting. So we are saying this to all doctors to use threads in proper way.
Marlene, many doctors, especially facelift experts from the US, they said don't do anything before the facelift, otherwise the facelift will be more difficult. In your experience, because you do both, you do thread and you do facelift, is it a little bit more difficult in your hands to do a facelift after Aptos, or for you the same?
Фейслифтинг – очень серьезная операция. Доктор должен быть высокой квалификации. Если он высокой квалификации, для него никаких проблем не представляет оперировать пациента до нити и после нити тоже. А я такой.
Madloba.
So facelift is quite serious operation, and when you do this type of surgery, you need to be really well experienced. And he said that he is well experienced. So
yeah, okay, but
there is no any problem.
No problem.
If you are well experienced, so you can deal with threads, with fillers. What about secondary facelift?
Exactly. No, I agree.
Secondary facelift is much more difficult than facelift after threads.
I agree, but because he's doing both and he's the master of the thread.
For him, it's not
Same.
any difficulty.
No
so
difficulty.
We operated a lot of patients with the threads. So.
And the same question for you, Vakis. Vakis, you are the president of ISAPS. You know all these doctors, superstars saying, don't do anything, otherwise my facelift at 50, 55 will be more difficult, blah, blah. Don't you think it's a little bit, disrespectful? Who are we to say to all dermatologists in the world, don't do anything, don't work, just for me, when I do the facelift, it will be easier, faster, I don't know. Don't you think you need to take position, because this is very disrespectful?
Are you addressing to a specific chat or whatever?
For example, but not only this chat, all these, especially US doctors.
Well, yes, it's a long story. We cannot start this discussion now, Matt. But it's true that on the other side of the Atlantic, everything is compared to Europe, where we actually do things only on evidence-based medicine, only on presentations, only on literature, only on publications and everything different, okay? But I would like to comment on what Konstantin very correctly said about, well, also for a secondary facelift, you have difficulties in dissecting. Yes, but what I want to say is that on a secondary facelift, you have a fibrosis which is caused by the normal healing of a tissue on a tissue, while when we have used sutures or threads or injectables or whatever, the reaction is not the same as the wound healing. It's a foreign body reaction. It's completely different. We have to respect that. We do not overrule the use of threads or whatever. We love them wherever they are recommended for. But we have officially to have in mind that it's a different reaction. It's not the same of a flap that goes on the underlying flap and does a healing. It's a foreign body reaction. So sometimes we get more bleeding there, we get more, but that's why we're surgeons, okay? What can we say to our patient? That, no, I will not do you a thread lift because in 5 years you will have a facelift? Of course not. So we just have to be in mind and to know exactly what happens when we use these non-invasive products before we do our facelifts.
Thank you.